So, okay. Well, thank you for joining us. I'm sure we'll probably have some other people jump in as we go along here. But we wanted to have this. Dr. Scapillato wanted to address some of the issues with regard to special needs and their dental needs and that. And those of you that are with us, I know have personal interest in that, and I want to hear about that. So I want to make this more interactive than just Dr. Scapillato delivering information and so forth. So hopefully you have questions. I'm going to ask you to share your stories. So I hope that you'll openly share. And then I've got questions for those of you with your experience. So um, why don't we get started, Dr. Scapillato, um, with your experience with special needs patients from a dental standpoint. And the reason I'd like you to do that is not only for those that are on with us, but all those also those that will see this that aren't with us live, so that they have at least a baseline of where you're coming from and what your experience is.
Do you want my history,
Yes, please. So I think it'd be helpful.
education,
Yeah,
everything
yeah,
from
yeah. Kind
back
of
then?
this
You want?
the Cliff's Notes version, if you can.
Okay. Okay. I originally, when I graduated from dental school, I was planning on going out and do a one-year residency where you would learn to utilize the hospital as an adjunct to your dental practice. I'm a general dentist. Um, I did not get into a residency program. A year after I got out of dental school, I started working at Illinois Masonic Medical Center here in Chicago. And I was there one day a week and actually developed a program called a preceptorship, where dentists in practice would come and treat patients at Illinois Masonic, learning about hospital dentistry. Well, it turns out 99% of the patients that are put under general anesthesia were special needs. And it evolved into working with special needs. I found I was comfortable with them. And so it continues from then to this day. There was a period of time I was teaching the dental residency program at Loyola University. It was the residency program that a dentist would take after graduating, again, to learn about utilization of the hospital as an extension of your practice. I was a member of two hospitals. One is part of the Rush system today, Rush Oak Park Hospital in Oak Park, Illinois, and the other one at Loyola University. I am no longer part of those or on staff there because I have found an anesthesiologist who will work with me in my office for sedation purposes. So over the years, I have continued to practice working on every special needs patient that walks into my office. If we can't do them here, we sedate them now in the office and take care of all their needs in one visit. It's evolved. Excuse me. It's evolved where every patient that I work on in my office is unique, but the special needs patients are even more unique. You have to learn, I've had to learn how to relate to them on their level. Who are they? What do they bring to the table? How do I better understand them before I ever start to work on them? And I think that's what has enabled me to continue to work on them, because I can relate to them. And as I've always stated, for many of them, they know what's going on. They relate back to me in their own way, okay? But they're trapped in a bad body, but they understand what's going on. And if you work with them long enough, not as a group, but as an individual, you see that they do respond. And I've been very fortunate to develop the skills, but it's a difficult thing to teach because it's something you have internally. You can bring it out, but it's not something you can just memorize and every special needs patient is the same. No, they are uniquely different, and that's how you have to take care of them.
Yeah. And I will. I'll apologize first of all, and I want to welcome Nancy. Nancy joined us here. So, Nancy, are you able to hear us? Okay. Okay, good. I have everybody muted right now, and I apologize. I'm remiss in introducing myself. My name is Ron Sheets. I work with Dr. Scapillato in helping to promote the his special needs and a lot of other aspects and communicate what he's doing in his practice to the community. And one of the things that we have discussed over the last year is really focusing more on the special needs community and bringing great dental care to the community. So that's one of the things that I'm function in helping Dr. Scapillato on. What I'd like to do at this point is, Dr. Scapillato, questions for you, and then I'm going to turn to those that are joining us because I have a question for them. But first of all, would you share why why do you do what you do for the special needs community? Because there's so many dentists that don't and won't.
That is it's difficult for me to talk about, okay? Not from the standpoint of what I do, but from the standpoint of what others don't do. So I'll leave that aside. I do it because I just feel a connection with them. It's that simple. I have a niece who is Down syndrome, okay? But I was already teaching and already practicing with the special needs before she was born. And she is very high functioning. Just about any dentist could take care of her, okay? She doesn't present anything special other than relating to her as a Down syndrome person, okay? Um, but that's not why I do it. I don't do it just for her. I do take care of her, but I just feel comfortable working on them, and it's my way of giving back. The reason I think a lot of dentists don't do it is because it takes more time to work on the special needs. And today, with the disparity of reimbursement when it comes to insurance, time is of the essence in the sense that, you know, people, the doctors don't want to spend an inordinate amount of time on one person that they're not going to get reimbursed for. I think the other part of it is none of us were trained when we were in dental school, myself included, and I'm going back almost 50 years. Well, even today, there's not a lot of dental schools who are training the students, the dental students, to treat special needs patients. Though many of those who do it learned it in a residency program after dental school. It should be incorporated into the base education that everyone gets. And it's not that everybody has to do a lot of them, but if every dentist did a little bit, no one person would have to do a lot. So it's like sharing the load that's there, and this way more special needs patients would be taken care of.
Yeah. So good. And before I get to the others, what is it that you want to accomplish by spreading the word and increasing awareness about the needs of the special needs community, specifically in your area with regard to dentistry and dental care and systemic health and all that? What is your objective for launching the Special Needs Warriors website? And what's your mission? What's your goal in this initiative?
My goal is to make not, okay, to bring availability of the services to the families with special needs relatives. That's one side of it. The other side of it is to make the general public aware of how difficult it is for somebody with a special needs relative to get care. If for no other reason than to say, you know, oh, I have a dentist who does special needs, okay? And spread the word in their organizations, in their community that, okay, I'm there. Dr. Smith is there, Dr. Jones is there, whether it's here in Chicago, whether it's somewhere around the country, so that the special needs families don't have to pick up the phone and make calls. I have a special needs child, and usually they get hung up on instead of a place for them to be referred to, okay? Or this way, they'll know the dentists that are taking care of that will take care of their relatives, or even dentists who don't take care of them. At least there you have a resource to pass on to those families to say, here, I don't do it, but it's like, yes, I'm not a specialist, okay? But like any other specialty, like an oral surgeon, orthodontist, why not have some place to send somebody to if you don't do it?
Yeah.
So it works both ways. The more people know how difficult it is, the more they're going to be helpful spreading the word.
Yeah, I've been amazed that since the story was told on NBC in Chicago, the outpouring of interest and support. The other night, we had a dentist on with us from Tennessee. I think it was he in
Yeah.
Tennessee? And
Tennessee.
yeah, and he asked, "Can I come to Chicago and see what you're doing?" I mean, I was surprised but encouraged by that we're on the right path. Um, could I ask now for let me start with Beth. Beth, if you could unmute yourself and if you don't mind turning your video on so we can see you, I'm gonna I'm gonna bring you up here so that we can see you. So Beth, and I'm gonna ask this of everybody, if you guys don't mind. If you don't want to, I understand. By all means, decline, and we'll respect that. But I've got two questions for everybody. Is number one, if you could share so that we can share it with everybody else, anybody else that sees this, is number one, share your story of what your needs have been and what your experiences have been in the past, specifically with medical care, dental care, for your loved one, and then second of all, as to what you would like to get out of being with us tonight. So two questions. I tend to take a long time to land the plane, so be patient with me. But the two questions is what have your experiences been, and number two, what do you want to get out of tonight? And that question will be for everybody that's on with us. So Beth, why don't you start us off?
Hi, I'm Beth. I live in Oak Park. I had a very unique situation recently. I have worked as a special needs personal coach, job coach, life coach for people who have aged out for about 10 years now. I started with Opportunity Knocks. Anybody in this area is usually pretty familiar with them. I happened to see your article on the newsfeed. I work with one gentleman who is Down syndrome and is in his late 30s. My experience was having a family member that actually thought Down syndrome people couldn't get cavities, which was, I thought, amazing to hear. And I realized he was having problems chewing. And so I took him into a dentist I had been seeing. However, I'd been fortunate with him that he had actually gone with me previously to a dental appointment to experience it. So he was a lot more comfortable with it because of seeing it firsthand and seeing my reaction. However, just in the last 7 months, I have had a unique opportunity to kind of take on as an adult foster parent role for a young lady who is mute with cerebral palsy, and she now lives with me. And so I'm, a personal support worker. And she, I know in the past she had really bad dental issues, partly because of prior abuse and neglect within her family. And, it was hard to get it done. And then when she came to live with me right away, there was a problem with one of her teeth, and I took her to the same dentist I went to. And, despite the cost, which is, I know, a huge issue with dealing with Medicaid, and dealing with special needs, especially for somebody like me who is trying to help somebody and there's not a lot of money there or extra money, especially to take care of teeth. And he said, I'll take care of it pro bono, which I appreciated. And the minute he pulled out the needle, I've never seen the girl run as quickly as she had before. And she told me, previous work had been done under sedation. So it is something that people don't think about, even the anxiety involved with going to the dentist. I've even tried to educate other dentists because I have my own major dental issues being on disability myself, about leaving the apron on, the lead apron to calm people down, the compression, And the weight really is a calming effect for people in the chair and just little things like that. So for her, she obviously needs a lot of work. So that is my interest, but it's also about the affordability. That's the other huge issue, I think, as a special needs caretaker or parent is dental work is so cost prohibitive. So I think that's really what interested me in coming, and I really appreciate your, dedication to this, Dr. Scapillato. And again, a little discussed thing, but especially in Oak Park. I mean, trust me, I will share with every parent because it's a concern, and huge concern is the failing teeth, especially with Down syndrome and the teeth grinding and the protracted teeth. And, I know anything we can do to promote that health is great because a great smile makes you feel good.
Yes, all true.
So that's all.
Okay. All right. Good. Thank you. Because we're going to gather these all, and then we'll kind of address some of the issues. So thank you, Beth. I'm going to bear with me here. I'll play an engineer as well. Okay. Nancy, would you mind unmuting yourself and again, those two questions is experience. What is your connection and experience, and what do you want to get out of tonight or today?
Okay. She explained, she got hit a lot of the things. I have a 35-year-old son who has multiple disabilities. One of the biggest problems has been he had uncontrolled seizures. Luckily, knock on wood. I'm a nurse, superstitious, we knock on wood. Had uncontrolled seizures. So finding someone who is comfortable working on someone who has with no warning seizing. I understand the safety. Like I said, I'm a nurse. I understand that. We did finally get into the special needs clinic at Illinois Masonic, which everyone was great. It's just that with it being students, we would never complete something. I felt like, it was like by the time your appointments are so few and far between, because the demand is so great that by the time we would go, instead of the things that were initially being a problem, then something else was wrong, or it was another cavity, or so a tooth had to be pulled. And it's just frustrating because it is. We live in Aurora, so it's a pretty hefty haul to go to, and then with COVID, it kind of made a lot of things happen. It just would be nice to be able to have dentists somewhere, like just in general, where we don't have to feel like you have to make justifications for behaviors, because my son had a brain injury at birth, so he has a lot of behavioral issues, not to mention the seizures and other medical problems. So it's just, I think just looking for resources and as she mentioned, cost prohibitive. Most places, most dentists, just like finding doctors, will not take Medicare, Medicaid. My son is, we're lucky because my husband's also disabled, that my son is on Medicare and Medicaid, but it's just, I guess, just looking for resources. We've got, there's multiple, and I'm sure I know I'm not the only one who, with our family member or person that we're caring for, it's so complicated. It's so complex, their needs. And just to have someone who understands. And it seems like from when I was watching it on the news, just the fact that you recognize that that's a special need that I think as family members that other people don't recognize if they don't deal with it. And just to be able to, my son will talk your arm and leg off, but there are certain things that he will just kind of panic about. And especially with the seizures, I understand, I recognize that, yes, it's a complication that is scary for people who don't deal with it, but it's our life and he still needs dental care, So, and it's helpful. And I really appreciate that you're bringing recognition to it, because I think that's something that those of us in the community understand, but outside people just really don't understand it. That is it's a hard thing to find someone who will be patient and listen to them when they're whatever, to try to, establish a rapport kind of to where you can help them cope better, I guess,
Yep.
and also understand the seriousness of, we still have arguments about brushing teeth, it's, I'm sorry,
And,
that's it.
It's
no,
okay. It's okay.
Ron, I'd like to comment one thing that
Oh, absolutely.
you brought up and one of the others had brought up is about, nobody, it's hard to find somebody who's going to treat their relative who is on Medicare and Medicaid. Well, here in the state of Illinois, Medicaid, once they're over age 18, they're basically paying for extractions and dentures. They don't want you to save the teeth. They don't want to pay for long-term maintenance. They'll pay a little bit to have a cleaning done, but beyond that, it goes out the window as far as real quality day-to-day care. And Medicare doesn't pay any of that. I've even tried to look into Medicare as a provider to pay, let's say, for anesthesia in my office, which would help to get a lot of work done. They won't do that for dental care, okay? And that's part of that is because we're in the state of Illinois. Okay, so there's different rules, different states, but that's how it is. And that's why nothing gets done for the adult on Medicare and Medicaid because they're not really paying for much. They'll pay a little bit for a cleaning, but after that, you're on your own. They'd rather have you lose all your teeth and put in dentures, and then they never have to worry about you again. That's just how it is, which is unfortunate, but it's what we have to deal with. A side note to that, in my office, and I know in a lot of other dental offices, they have installed a in-office dental care plan, much like an insurance plan, which will help alleviate some of the cost of the care, just not only for checkups, but for fillings and any other work, okay? But the key is to try and find the offices that want to start taking care of special needs in general and let them know it's not as difficult as they might think. And even if somebody like any of your relatives might be more difficult, at least if they said yes and they looked, they could then refer to myself or somebody else who would handle it. And you don't feel like nobody cares.
Right.
Yeah. Well, something that's new and I haven't even discussed this with you, Dr. Scapillato, because I'm trying to get more information on it. But as recent as last week, having a conversation with another dentist in another state about the subject of treating special needs patients, he informed me, and I don't know the specifics and I don't recall the name of it, so I'm digging into it deeper. But he told me of a resource that he knows of that's available that will assist not just special needs patients, but patients in general. But it can be for special needs patients. So I'm trying to dig in and get more information about what this other program is that would assist families with covering specifically for dental care and dental treatment. As you were talking about in Illinois, it's only, cleanings and extractions, and then that's it. They don't want to save anything. But I'm trying to get more information about what that is, and as soon as I get it, we'll compile it, make it available. So hopefully that will be another resource to alleviate, because that's a common thing that I'm hearing from a lot of people is regarding the cost, and it's not just cost for us, but it's cost for anybody with dental care, because dental insurance is not really insurance. But Nancy, thank you very much. And hopefully we'll come back to you if you have more questions. By all means, let me get you out here, that out, and get mine done. And then Jen, if I could ask you to you already unmuted. Good for you. You're way ahead of me. Okay. So let me jump in.
Hello, Jen.
Hello. Hi. Beth and Nancy have pretty much said it all. But I do want to share that, my son is 13 years old and he's going to be 14 in May, and he has autism. And my experience with any kind of medical or dental care has been awful. I mean, he is considered nonverbal. He has some words. He can express some of his needs and wants and fears. But I will tell you, I feel like I leave every doctor visit sweaty. I feel like he's sweaty. I feel like my stress, and I'm a single mom, so I'm kind of doing it all on, on my own. I'm in Indiana as well. I'm not in Illinois. And by the way, I did drive to see Dr. Scapillato last week, and oh my gosh, I am so excited to work with Doctor and his staff. But I'm sorry, I'm getting sidetracked. But back to my son. Yeah, he's always a mess. He always thinks he's getting a shot. Everywhere we go, no shot, no shot. And anytime we walk into any sort of medical building or anything, he's just, the anxiety level is woof. So I will tell you, I saw a doctor on NBC5, made an appointment because Nolan is my everything. I will do anything. I will drive anywhere. I will fly anywhere for him. He has some sort of issue. I don't know, doctor, if you remember last week, Nolan, he has some sort of like intrinsic discoloration. Sorry, I know you don't need to hear all the details, but, and obviously that's concerning to me because I take care of my son's teeth. I try to brush them. I teach him to brush. And doctor was so thorough. Doctor's hygienist was so thorough. I've never felt, I just want to share this, I've never felt more accepted, I guess, at ease than I did at that visit. And I think Nolan felt the same. Nolan sat in that chair for, I'd say, an hour and 25, hour and a half. And I could not believe it. And yes, you're right with the, I'm not sure if it was Nancy or Beth, but with the vest, I think that helps too. But he didn't seem scared. I can't remember the hygienist's name. She was so great, but oh gosh, she was amazing. Lexi, no. And I know that, I don't know, I'm just excited. And I've been bragging about you, doctor. I know I've only met you once, but I've been sharing things about your office in Indiana here. I live in Munster, Indiana. I don't know if anybody's familiar with Munster, but that's where I'm at. And you guys are right about insurance. It sucks. Let me put it that way. And being a single parent, it's difficult. Sorry about my dog.
That's okay.
But she knows I'm on the computer.
We're all animal people, so no apologies needed.
Yes. So but that's it. And I do have a question for Dr. later, but that's my story. That's Nolan's story.
Well, I kind of got to you last, Jen, because from what I understand from Dr. Scapillato and from Ayanna and so forth, you actually run a blog and you have a website, which I want you to tell people, what is your website?
My website is Autism Moms Together. And it's a place for moms to share their stories, experiences, successes, failures, anything. I write about some real personal things. I do get very candid, and I do get some feedback. And I think that if you're candid, I don't know. I feel like it helps me that I'm helping other parents out there. I guess I really did it I needed some help myself, I think. And I think writing helped me. And when I realized that I was helping other parents and reading their stories and they're reading my stories about autism, and because sometimes you can feel alone, whether it's, going to the dentist, doctor, store, anywhere, you can feel like you're alone sometimes. I think knowing that there's other people out there is very helpful, and that's what I try to make my website a place where we can kind of gather together and discuss anything freely, be candid, open.
Yeah.
So yeah.
Yeah. Well, you said you have a question for Doctor. Why don't we just jump in right there? And Beth and Nancy kind of voiced theirs, which was regards to cost and resources and so forth, which is what we're really looking at building. But what is your question, Jen?
Okay, my question is, what is it? Your Warriors website?
Special Needs Warriors.org. O-R-G.
And that's, my question is that just for Illinois doctors and Illinois?
We are trying to build a database of sharing information, much like you do, okay? But more importantly, where are the providers here in Chicago, here in Indiana, anywhere across the country, okay, that people can find somebody, even if it's not close to home, at least they know they've got a resource, rather than calling up and getting no results at all till they find it after 10 calls, 15 calls, whatever the case might be. So it's building the database of providers as well. Basically looking at the dental need, but I think as it grows, there might even be a side of it that would present the medical need, meaning doctors who are willing to take the time and work on special needs patients.
Yeah. The big 30,000-foot view objective is that if there's a mom like you guys that's in Los Angeles, California, and they can go here and find a dentist in Los Angeles, California, who says, yes, we work with special needs patients. I mean, that's really what the big objective is to build. So we're starting in Chicago because that's where Dr. Scapillato's at and wanting to expand. So we're really just asking and trying to get help anywhere in the country. If you know of a dentist who is good and works with special needs patients, and that, get on the site, register for the site so you can be listed so other people can find it. That's the big 30,000-foot view objective, but also to share information. So, I mean, do you all think that there's a need for that?
Oh, definitely.
Yeah.
Like I said, just from my experience of now kind of, being a, I don't like to say parent, but a mentor and roommate to somebody, who she's mute. So she also has a slack jaw, the drooling, which of course affects the teeth as well. And just people that don't understand it, even for myself on disability, who suffer from depression, and trying to explain to a dentist about what depression is and how you're not thinking about hygiene and, just having a more comfortable place to go. And even knowing that it's a network of people, because I mean, as I say, I've always felt anybody that commits themselves to special needs, you obviously have some kind of, angel wings going on, because you're not going to do it and, exploit these people. Because again, there's no money there for you to exploit, first of all. And that's the other thing with dentists. You go in and it's like, you just have to have this done. And it's like, I don't have the money.
Yeah.
And I got with Fiona, it's like, oh, she has wisdom teeth coming in now, and I have to deal with all this and trying to get her hygiene. And same thing as Jen said, discoloration permanently on her teeth, and it looks like she doesn't brush them. We're like, we've been doing it for 7 months, but shows no difference, So I mean, yeah, I mean, I'm a big about sharing any of my resources with everyone, because like I said before this, I was a special needs coach, and especially as Oak Park is kind of, I always feel like ground zero for special needs around here. It's kind of become the mecca outside of Chicago for it, for those that aren't familiar with Oak Park. So I mean, to find something, a resource in my own backyard is amazing.
Yeah.
And I will say right now, I look forward to working with you, because I already know Fiona listened to you speaking and she likes you. So again, it's just somebody that understands, and it's so hard to find people that understand, and that every person is unique. And, even a lot of doctors have pulled away from gas and different things, and then the whole needle thing is not going to happen, especially if you have sensitivity.
Yeah. Yeah. The other thing that we're looking to do is, so we're actually asking for help from you guys and anybody. So, in this day and age of social media, if there is anybody that's, on social media and can just ask, do you know of somebody in your area? Because social media allows us to expand beyond just, the confines of our own geography. So we're asking for help too, of just, who do you know? Are there dentists out there? Because we've got resources where we're going to reach the professionals. However, we know that's not the only avenue that we can go after in order to connect with these people. And like Dr. Scapillato said, it won't just stay within dentistry. It'll be health care in general. But that's his focus, and his interest is in regard to dental care. Um, Doctor, if you could talk about for a second, and I want to address the question or the concerns that came up from a couple with regards to the affordability and the cost. And I don't know the answer to this, so I'm going to just pose it. But you and I've talked about other options or other resources for getting dental care paid for or covered and so forth. Are you able to talk at all about that?
At this point, no, because I'm developing those resources as I get feedback from the general population. Only thing I can talk about is what I have in my office as far as a dental care plan, which is still better than 100% out of pocket, because there are some discounts built into that, which makes it a little bit more helpful. But as far as agencies that would pay for services, I am not familiar.
Okay. So aside from the Medicare and the Medicaid, which is limited,
Right.
and traditional dental insurance and that.
Now,
So,
maybe some of the people on today can answer, because I believe at one time Easter seals, maybe they still do it. But I don't know that they cover dental care. And it's usually for a child more than it is for an adult. Now, maybe nobody here knows that, but I know at one time they did. Um, Beth?
I mean, for me, I don't know about Easter seals because again, I know Fiona went when she was younger. I think it's more for the younger kids than the adults,
Do
which
they pay for dental?
again, I'm not sure. Fiona had mentioned she
Okay.
went when she was little, but like I said, I don't have a lot of history and because she's mute. It's hard for us to communicate 100%. But I do know, like, one thing I know I'm going to be trying to look into is I know a resource that some parents don't realize, but unfortunately, no matter how old your kid is, a lot of times the senior services in your area, like in Oak Park, we have a huge senior services with our township. And so I work with them and they will help kind of sometimes, like they've helped me myself get supplemental insurance and to be able to find things that are zero cost, zero copay versus knowing you need a lot of work, which is the next step I kind of need to look into for myself as well as Fiona. But Fiona's not on Medicare yet. So again, we're in that holding pattern right now. But so senior services is always a great place to look at because even though it's senior, they cover the Social Security. So even if you are disabled, they will give you the same services that they would give a senior person on social services. And it's a lot easier than trying to deal with DHS and the other community agencies. So that's the big one I always try to advocate for is to tap into senior services in your neighborhood.
Thank you.
I'd like to say, I actually pulled this up. I don't know if they'll cover anything medical, but there's a foundation called Modest Needs Foundation. And I applied for a grant and we actually got it. My son was like obsessed with light bulbs and it was like a thing where it would just cost me tons of money. I kept having to buy, like he knew if they were new and if they were old. So I was just buying and buying and buying and buying and buying and buying and buying. And then I kept all the receipts and they actually reimbursed me I had the receipts and they actually reimbursed me for that. And it's for like I want to say it was like a one-time, like, what do you call it when you have I can't think of the verbiage. Like something like something happens, like an accident. Yes. Like a one-time situation. And it was called Modest Needs. And there was another one too. I know that was on Autism Speaks. But I think I don't know if they cover anything medical, but I did apply for that and they did help me, which was great.
does anybody, so you bring up an interesting point, Jen. Is anybody have knowledge? So you mentioned Autism Speaks, but there's like Special Olympics and these others. But does anybody, there's some of the organizations that we have talked about reaching out to connect with in order to expand, because really what we're looking to do right now is just expand the connection and the reach and the communication. Are there any other organizations that you all know about that you can share? So you mentioned two here, Jen: Modest Needs Foundation and then Autism Speaks. Are there any others that
Yes.
you know of? Yes, please.
So besides Special Olympics in Illinois, the Special Recreation Associations, but also there is a parent group on Facebook. It's called Illinois Parents of Adults with Developmental Disabilities. It's called iPad. And it is all people. It's not necessarily just parents. It could be siblings. There are administrators, but it is a wonderful resource. It is for adults more like, when kids age out. I mean, people will talk about when their kids are aging out of school, but it's Illinois. It's throughout the whole state. And it is a really good resource as far as even, like what stuff is coming up, things for legislature as far as things that are covered. So that is, it's a really good resource. And I have found through the 35 years that I've been a special needs mom, other parents you get a lot of information from, or other people who are involved with, whether it's a sibling who's a caregiver or a friend. But iPad is a really good resource. And I meant to try to post about this, but yeah, I mean, because people will ask, do you have recommendations for a dentist, a neurologist, psychiatrist? What do you like things for behaviors that our kids might have, any suggestions? So it's a good resource, and it is statewide. I was by another special need parent that I found out about this group, but it's.
And you said it's iPad. Can you say what the acronym stands for? Illinois Parents
of Adults. I can look at Illinois Parents of Adults with Developmental Disabilities, I think is what it's called. But it covers a lot of, there's people with just about any kind of thing. Beth, Jenna, I think because your son's a little bit younger, but Beth, I think, it might be helpful for you too. I mean, the people will talk about day programs or behavior. It's kind of a catch-all. And then they have libraries where people could go back and, whether it's like applying for the puns list or, things like that. So it's a very good resource, I think, it's, I don't know how else to do it except that I know it's on Facebook. So I get notifications.
It's a Facebook group. Okay.
Yeah, it's, sorry. Illinois Parents of Adults with Developmental Disabilities Unite, it says, but it's, and then they do have, I think they have, resources maybe for kids who are younger. I don't know about other states, but you can look, there are a lot of different support groups because you get so much more information from other parents. I found that from school. Medical wise, I'm a nurse. I knew what to do with the medical things. I didn't know what to do with school, job things. My son has never had a job because of seizures. And so now that he's not having seizures, he wants to know why he can't get a job as a stand-up comedian. He's not real realistic.
But they do have a great, speaking of that, sorry, I know we're so sidetracking you, Dr. James. This is what happens when special needs parents get together. As I'm
no,
sure
this is good.
But we have the, actually Second City, I know it's a little bit far, but they do actually do it online as well. They actually have an autism program, which they encompass different special needs, but it is different improv for autism. And so it really helps them, because I actually went through improv for anxiety and I actually graduated through Second City. But the way they work with it, it gets you to think out of your comfort zone, which is so much of autism, and to learn to play with kind of the what ifs.
Yeah.
So again, if he's interested, they might have stand up for autism,
I'll look that up.
Stand up for anxiety, so they might. So
that would be cool because he wanted to do it. And there's the comedy club that was out here closed. It was like he was, and it's like, oh, okay. Well, so much for that. So,
but yeah, like I said, I'm like a weird resource person just because I've been working in the field before kind of becoming an parent role. So I know here in Oak Park, as I'm sure you're aware of, we have Opportunity Knocks. Oak Lyden is a big one where I know that they were in the past doing a dental van there. However, beyond the cleaning, it was up to the parents, obviously, which again, the burden of cost and everything else. And then as well as, like I said, Oak Park High School. Any of the special needs families there, working with anybody at the high school with Miss Joyce Vaughn. She's a big person I talk to a lot there. She's always happy to put together a panel of special needs parents for anything, especially, community related. So those are, probably the big hits here in Oak Park. Just since you guys are located here, but yeah, Oak Lydon, the day program. Oh, and Seguin is the other one too. UPC Seguin in Oak Park, as well as Seguin and Cicero are the big programs.
And the program at Illinois Masonic is, I appreciate that they do that. I know, because it's mostly, I think they're residents, doctor, that's probably what they are, right? Residents there. And they're very nice. It's just like I said, especially with someone with special needs, you kind of want to have a completion. And I feel like it's like we were going for many years and we never really got to, like, he's now missing teeth because we couldn't find a dentist when he was younger and he had overlapping teeth. And so and then it just became, you lose more and more teeth. And now what do we do? He's 35 and he probably needs, I think my daughter said it was called a flipper, but it's like, okay, but when do we do this? You know what I mean? And he's at 35. He was telling me today, does he need dentures now? And he's only 35. And it just, you feel like, I appreciate that they did that. And it is covered, I think, because it's a dental school. So that was no cost, but you felt like there was never going to be an end in sight. You know what I mean? So it's very difficult. He's very fixated. Like if you say, maybe you can do this, he takes that's tomorrow. We're going to do this, so it's really hard to get him to kind of follow through it, especially when he doesn't feel like there's ever an end in sight. And it's hard for me too. It's kind of like, I just would like to be able to know that, yes, we can get this so we can move on to the next thing that we need to do. And I don't feel like that was one of the problems with going there. It was like, you need to go every 6 months and then be like, oh, now you got another cavity. So we can't do anything else. So we're going to go. And then it was new resident each time, which I get it, but I don't know whether any of these people, when they're done with school, then when they go into a practice, are they going to be willing to take special needs, even though they've worked with them through the school? I don't know. Is
that's part of the difficulty is many times, like I said before, it becomes economic.
Mm-hmm.
And that's why the more difficult the patient, the more time it takes, the fewer people there are to work on them. Yeah. But I know there's more people out there than myself. Right. That's what I want to do, is find those people. And I will do what I can do for as long as I can do it. Okay. And I've never looked at that as an issue for myself. This is what they needed. This is what they got. Okay. And the cost for that was the same as if I could do it in a third of the time. Okay. I hate to talk economics, but you talk economics too. There's a cost to it. Everybody understands that. But again, if everybody did a little bit, it would get more special needs patients taken care of instead of the families being turned away by dental offices. And they're not doing it on purpose. They're just uncomfortable. Okay. We need to make them comfortable. Not you as parents and family. It's me saying, look, just say yes. Get them in the office. You might find that I'd be willing to bet at least a third of them you'd be able to do. Those offices could do, and not spend any more time than they spend on any other patient, because they're that high functioning. Okay. The more difficult ones, fine. Just have a resource. They're out there. And more of those who have been trained, I would think they're doing it, but I'm still seeing the same issues today as I saw 45 years ago when I first started. And it's going to have to start with education in the dental schools. And
go ahead, Ben.
Okay, a lot of them still may not continue it. That's okay, but you still got more trained.
Saying,
we can't do it because we were never trained.
Well, it makes me kind of think of my dad, who was a lawyer, but always pro bono. But then, it's like he'd try to draw the people into the practice on their graduating and wanting to do good for the world. And then they saw what they could do if they became a partner. Yeah. And it kind of went away, so it sounds the same. Exactly. Another resource I just thought of for you, Ron, is the Adult Down Syndrome Center in Park Ridge through Advocate Healthcare, which is run by Dr. Brian Ciccone. which is one of only 2 places in the United States like this. But they would be a great resource to work with because I'm sure they have their own referrals of dentists as well for their clients there. So they're really friendly. I mean, unfortunately, I haven't been able to get my clients to go there, but I've gone to conferences with them, and they're really good as well. They work with videos and making videos and showing people how to do hygiene, which is a great resource for parents. So they also have that even on their website, but like the hygiene
What's
videos.
the organization again?
It's the Adult Down Syndrome Center, which is with Advocate Health. And
where?
that's,
In
it's
Park
in
Ridge?
Park Ridge, yeah, Illinois. And Dr. Brian Ciccone is the head of it. And he's actually written a few books on special needs and dealing with all the
Can you spell his last name?
It is, I believe, Ciccone. Let me check. Hold on, I got the book handy. Hold on.
While she's looking, can I ask a question?
Sure.
Doctor, I know we're coming, this is sort of so we're coming in April 13th to see you, and my son needs some drilling work. And I didn't get to ask you this. So let's say that, because I think we kind of decided he might be able to handle it without general anesthesia. What if he can't? Is there will you know right away? Will there be somebody there just in case? Will that be a whole different appointment? I guess I'm kind of nervous about that because the only work he's ever had, he's been under, and that was a long time ago. He had a baby root canal, they called it. And I guess I'm just kind of nervous about that. How does that work?
If he would not sit at all for me to do what I need to do, then it would be a separate thing to where we'd have the anesthesiologist come in and put him to sleep and do all of his fillings one time.
Okay.
Not like a regular dental visit. Oh, come in and we'll do 2 fillings. No.
Okay.
It's going to be everything. We set aside a whole day. It's not a part of our regular week. I'm off on Wednesdays. If we have a case, we do it on Wednesdays here in my office. So, a lot of doctors don't want to take time out of their regular schedule. Well, I'm not taking it out of the regular schedule. I'm adding to my schedule.
Mhm.
But it's not every week. So yes, we would come back, we'd set it up. Here's how much time we need. Anesthesiologist comes in, puts him to sleep. I do my work, wakes him up, go home. It's the same day surgery procedure right here in my office.
Oh, okay. Thank you.
Okay. Does that answer your question?
It sure does. Yes. I just wasn't sure if it was I heard you talk about it earlier. I didn't know if he was going to be there. I pictured him sitting there, seeing if it was going to be possible. And then if it isn't possible, then he would jump in. But I guess it's a whole different. Yes. Yes. Okay.
Okay. We'll see what we can get done the first day. That's going to be the gauge. What can we accomplish for Noah? And then we'll take it from there. Okay, maybe his level of accomplishment is 2 fillings instead of 3 or 4. It's okay. I know there's a little traveling involved, but the key is if we don't need to do a general anesthetic, I don't want to do it. Okay, because then you get, not that you get locked into that, but if I can do it in the routine dental office setting, I'd much rather do that.
And I may be speaking out of line, but I'll add that in the short time I've been exposed to with Dr. Scapillato and with the patients, I've seen and heard from stories from moms specifically who, like you, Jen, they didn't like the drilling and so on and so forth, but over time they were able to get. So I'm thinking of Oscar, Dr. Scapillato specifically, is that over time he can have it done and not have general anesthesia. And it really, I think the thing that's amazed me, and it's so simple, but it's just the personal care and the personal attention that really, to me, seems like the game changer for that dentist-patient relationship. And like Dr. Scapillato says, a lot of it comes down to economics because they just don't want to spend the time. But seriously, why isn't that kind of care, and I'm getting on my soapbox, so forgive me, why isn't that kind of care delivered by dentists, physicians, or whomever in general? And we know why it's not. It's because the insurance companies are dictating to them what it is that they do. And I can get away with saying that because I'm not a doctor. I'm a patient just like you. And for the record, I'm in Cleveland, Ohio, and I have a wife and 2 kids. And Dr. Scapillato is our dentist. And my mom lives in Orlando, Florida. And Dr. Scapillato is my mom's dentist. And that's because both she and we have had really crappy experiences with dentists locally. And we don't have special needs. We just need dental care. So that's kind of why I got on the bandwagon with this too, and that because it's personal. I had the conversation with my sister, and my sister's like, "You travel to Chicago for your dentistry? Isn't there somebody you can find locally?" No, I mean we've tried, and I work with dentists all over the country. So it's so forgive me again. I take a long time to land the plane.
No, I agree. It's the insurance cost versus sliding scale. And even like I said, I had bad teeth because of my depression and years of issues, and I feel like I'm like still suffering the consequences of bad choices in my youth, unfortunately. But you go in and like, I think the last time I went in, I had an abscess. I was charged $800 for Novocaine, and that was it. Like, and they squeezed it, and you're like, $800 for Novocaine.
Yeah.
So. And I'm like, I can understand if that's the insurance price, but what's the, again, that give. And I mean, I understand everybody's works to make money, but there's also, I mean, even for me doing what I've done as a labor of love, which it sounds like you do as well, is that, you take the cuts when you need to, because you want to help people. And that's, I guess, just my upbringing and what I believe. That just blows my mind sometimes, that's like, here's such a worthy person that's doing so much, but why can't you meet me part way? That I know you have to pay X amount for your labs and crowns, different stuff, but as well as Ron, I've had dental work. I'm like, why don't I get a warranty on this? If I paid this much for a car part, I'd have a warranty. And I've had crowns fall out, and I've had this fall, and you're like, what am I paying for? So again, on the personal thing, I totally understand. But I did put in the chat section about Dr. Ciccone as well as the Advocate Center. And there's a lot of resources on there.
Okay.
So
Thank you.
Thank you, Beth. So
yep, no problem.
All right. I want to be mindful of the clock and respect everybody's time here. We're coming up on the top of the hour. We've been at this for an hour. Doctor, is there anything else that you want to share, that you want to tell? And one of the things that popped into my head as a question, and I don't know if it's a valid question, and that is there any advice you could give, or directions or instructions that you could give, not only for these folks, but anybody else that may watch this, as to what they can do on their own to help prevent? And again, forgive me, it may be a dumb question, but it's one that popped in my head is that what could people do before, or in the case they can't get to a dentist because they can't find anybody?
Well, part of the answer to that question is, for those who are out there, besides the people here, when you find a resource, share it. That's number one. Also, I have had at least, and it's not, I don't think it's come up just because of the NBC piece that was done in my office, because that was just about awareness. I have had several people say, I said, well, how did you find me? They said they looked up special needs dentist. So if people start to share the information digitally, it's going to spread and other people will see it. It's just that when it goes on Google, there's what's the word? There's a
Organic.
Algorithm.
Oh, what?
The algorithm of
The algorithm.
your name up
you.
there. Yep.
You got to have the right algorithm for it to be out there. But it seems like in this case, special needs dentist seems to be the thing that sparks and it comes up. So again, it's about sharing the information you have with those that you communicate with. Like in John, you have maybe a bigger group than some of the others do, but that's okay. even a small group is going to help, because who knows what the next one is or the next one is that has a bigger group that they can share it with. So that's really what it comes down to. When you find something, let other people know. And then back to the database, let's get it on the database so people elsewhere, because I'm sure the information isn't going to stay local to Chicago, and it's not going to be shared only in Chicago. People live everywhere, and they're seeing stuff from everywhere, no matter where it started from. So,
Yeah.
you know, when you find something, let other people know.
Okay, good. Thank you.
Can I
Does
just
this-
say, I just want to thank you again, Doctor, and also you, sir, Mr. Sheets, for this opportunity to just for the discussion. And I feel like it's authentic, and I just appreciate so much. It, like I said, it's so very rare. I know I can't speak for everyone, but that where I feel safe, comfortable, relaxed, feel like it's a good place for my son, feel like, you know, he's understood. Like I said, I have one visit, hour and a half, and I feel like we have found a place, like somewhere that actually we feel accepted. And I will continue to share as much as I can. I told my son's teacher at school, she said she would share it with parents, and I've been sharing it on Facebook. You know, it's very rare to find something like this. I guess I don't know if it makes sense to any of you guys, but to me, I was so excited about this tonight, and it's a Saturday, and I was like looking forward to this, just because you know what I mean? Just to hear Doctor and just to hear everybody else and experiences, and I appreciate it. Thank you very much for this opportunity.
Well, Jen, how can we help you? How can we help you in return with your group and what your group needs to hear or wants to hear? How can we help you?
I guess I guess the website, Doctor's website, when that I would like to, has that developed yet, or is it developing?
It's developing.
Okay.
It's an official website. You can go there, and we're starting to put information onto it, including doctors. But we don't want people to just put information on there. We're taking a look at it. We're making sure that, you know, it's acceptable to the community, but it's going to be stories. It's going to be doctors that we can refer to, but we want to, some of them I know, I would ask them first rather than just putting their name up there.
Right.
Okay. All that kind of stuff is behind the scenes. So little by little, it will grow, but the website is official. That name is there, and that's where we want to get our start to spread the word. And like I say, I want it to go beyond Chicago. Yeah. Wherever they are. And maybe that person's 100 miles away, but it's a start. You have some place to go. That's a comfort in itself.
Yeah.
Yes.
Yeah.
Thank you very much.
Let me take this opportunity, if I can, let me share the screen. Let me go to the site so that you guys can see it. But as Doctor said, it's developing. Are you guys able to see the web page? You're able to see the web page? Okay, so
yeah, everybody's shaking their head.
Okay, I have two monitors. I was looking over here.
Okay.
As he said, it is developing, so it's very basic right now. We have a home page, and we have a join the group. The join the group page is really for like you guys. In order to be able to join, there's your story. You know, share your story, what your experiences are. Because again, we're trying to develop a database, but also a community. And then there's a referral warrior. And correct me if I'm wrong, Doctor, but I think this is the area where if there's a dentist or a healthcare provider that you're aware of, they can enter or you can enter.
Put it in there. And then the next column is the listing of warriors on the database.
Yeah. Then
just to refer a warrior, and then we would contact that person, make sure they're comfortable having their name put out there on the website, let them go take a look, feel comfortable, go from there.
Yeah.
Okay. So there, for instance, okay, that's me. Okay. That's the only one that's listed so far because that's the only name we have. I know a few dentists in the area. I just haven't had the time to go and pick up the phone and say, hey, do you mind if we list you on? And let them go look at the page, and they'll see what it is we're trying to build. And that's how it's going to grow.
we had a gal with us on Thursday who's a hygienist in another office there in Chicago. And she joined us because she's looking at bringing this into their practice. And if they actually asked about coming out and shadowing with Dr. Scapillato, and if they can develop it, put it in their practice, and they're good, they would end up here as well as a resource. But yeah, so anything that anybody can do to help us expand this, um, and get them listed. And I hate to use the term vetted, but Dr. Scapillato will talk with them and make sure that they're authentic and legitimate and can be put here. But anybody that can help spread the word on this, but it is very basic right now. And we're looking for, like you've done, Jen, is we're just to build a community and expand. And here we have 4 of us or 5 of us tonight. We want it to go bigger. Okay. We want it to be more. So we spread the word. So, okay. Again, I want to be respectful of everybody's time. Doctor, is there anything more you want to add? And gals, I want to ask you, is there anything more that you want to hear about tonight, you want to learn about, or any other questions? So I don't want to leave any rock unturned.
I really have nothing more to add per se. I'm open to more questions just to, pick my brain, whatever I can be helpful, whatever the case. I think bottom line is just spread the word, okay? So we can help others, just like all of you have been doing anyway, but now we want to do it in the dental community. I think it's long enough that the special needs have not been serviced by the dental community like I think they should be. That's my soapbox to stand on. And up until now, I've been pretty quiet. Now it's time to be a little more vocal and be more helpful to the extent that I can. So thank you for being on and sharing your ideas.
Thank you. My one question is, can I call and
you.
make an appointment on Monday?
Well, I was just going to ask, Doc, is it, are you comfortable? You want to share your contact information, either your email or Claudia's email and phone number? I mean, how can people, if they have questions for you?
My office is family. Well, go to the website.
Yeah,
It's just as easy. They can maybe take a screenshot of that, but it's Family Dental Care of Oak Park, 708-848-3727. That's my website right there.
Well, thank you so much. And again, I think Dr. Ciccone would be a great resource because he has
Yes, I will check into
his
that.
resources
And just as a side note, Beth,
Mhm.
we're not in the office Monday, call Tuesday.
Okay, I will call Tuesday then. Thank you for letting me know because I'd be frustrated.
I don't.
And Beth, you're going to be so
Time
amazed.
after that.
I'm excited. Even Fiona's sitting here and she's like, I like this. It seems comfortable. So we're
Beth,
good.
you are going to be so amazed. I'm not kidding. I mean, I felt it was great. I mean, who says that about going to a dentist?
I know,
it's
never.
crazy.
Yeah,
It's crazy. So yes, you'll be very happy.
Done.
great.
But that's what I do for every one of them that comes in my office.
Yep.
Right. I appreciate I'll probably be the test subject. So
Okay.
Well,
Thanks.
Jen beat you to it. So,
Okay, I'm going to go, guys. Thank
everybody,
you.
thank you
Bye-bye.
very much. We'll call it a night.
Bye.
Thank you, everybody. Have a great
Thank
evening.
you.
Bye-bye.
Bye.
Bye.